So in these conditions, the nipple discharge will be the milky discharge. In pathological causes, the main thing is that it depends upon the color of the discharge. What is the color of the discharge? After history, and then also in history, the pregnancy is also important. The patient is having pregnancy or not. And after that, if it is a galactorrhea, then simply reassurance, nothing else we can do. And do the investigations like hypothyroidism we see. Hi, I'm Dr. Ahmed Hussain Pathan, consultant general and laparoscopic surgeon, and you are watching my YouTube channel SurgiTalks. Today I am going to discuss about the nipple discharge of the female breast. Nipple discharge of the female breast having multiple causes. It starts with the physiological and it could be the pathological. In physiological, it is a milky discharge on the patients or the females who are having the pregnancy, or children whom she or females are feeding, and the mothers who have stopped feeding to their childs. So in these conditions, the nipple discharge will be the milky discharge. In pathological discharge, it could be the benign or non-cancerous and the malignant or the cancerous causes. In pathological causes, the main thing is that it depends upon the color of the discharge. What is the color of the discharge? The color of discharge could be the milky, could be dark brown or dark green or blackish, could be purulent, or could be the bloody. If the discharge is milky, then it is the galactorrhea. In galactorrhea, the cause is not the pregnancy. It is not related to any pregnancy. It occurs due to some other causes like increased secretion of prolactin hormones, hypothyroidism, and certain drugs like antidepressant drugs, antipsychotic drugs, and oral contraceptive pills. If the discharge is the dark green or black or brown, then it is the cause is the ductactasia, and there will be the discharge of the nipple will be thick and bloody and black and dark green or brown in color. If the discharge of from the nipple color is purulent, then it could be due to mastitis or inflammation or the pus, and the color of the discharge is the bloody, then it could be the benign or it could be the malignant one. In benign, it is the ductal papilloma, and in the malignant, it is the cancer of the breast. And the cancer of the breast, as you know that, or I have discussed in my other topic, there are many types of the breast cancers are there. So if the female having discharge from the nipples, so how she will be diagnosed or how she will consult or do to the management. So whenever a female having discharge from the blood, first of all, as I told you, the different colors of the discharge. So the female first of all assess the colors, and then after that she will consult with the doctor or the breast surgeon. The management starts with the history, clinical examination, and the management. In history, it starts with the age of the patient, which is age of the patient is, and what is the color of the discharge. And the color of discharge is painless or painful, and the color of discharge is having lump or swelling in the breast or not. All these factors will lead to the diagnosis. After history, and then also in history, the pregnancy is also important. The patient is having pregnancy or not. And after that history, the clinical examination. In clinical examination starts with the inspection. In inspection, again with the color of the discharge, the shape of the nipple, either it is retracted or not, and the color of the skin, either it is changed or not, redness is there or not. And after the inspection, then the palpation. In palpation, patient herself also examined, and the breast surgeon will also examine her breast and see that there is a lump or any swelling or not, or a significant limb swelling, or any hard mass is there or not. It is also important that the discharge is unilateral or the bilateral. So again, the surgeon will decide either on history and basis that the patient will tell that it is unilateral or bilateral, and the doctor will examine and then reach the diagnosis. After history and clinical examination, the turn is the investigations. In investigations, we start with the cytology or the inspection of the discharge. We take the discharge and send the bio to the laboratory to see what type of discharge it is and what organism it contains. And after cytology, certain hormonal assessment will also be done. And after that, some radiological investigations will be advised. That starts with the ultrasound of the breast, that tells about the internal structure of the breast and if there is a lump or not. And after ultrasound, if the patient's age is more than 40 years, then the mammogram can be advised. So after the history, clinical examination and investigations, if there is a lump, then the biopsy can be taken, fine needle aspiration cytology or the core needle biopsy can be taken to confirm the diagnosis that what type of swelling it is. So once a diagnosis has been established, then we treat the cause. Again, treatment is depend upon the cause. If it is a galactorrhea, then simply reassurance, nothing else we can do, and do the investigations like hypothyroidism we see, and prolactin hormone level we see, and if there is a disturbance, then we can treat accordingly. If it is a duct ectasia, then again reassurance, and if there is a pain, then we can prescribe the painkillers or NSAIDs, and if the patients cannot be healed or sometimes it cannot respond on the conservative management, then surgery can be proceeded. And in purulent discharge, if there is an abscess, if it is a small abscess, then it can be aspirated and treated with the NSAIDs and antibiotics, and it can most of the time it get healed. But if the abscess is large one, then it can be drained. And after the bloody discharge, if there is a ductal papilloma, so the ductal papilloma will be excised. And if it is a malignant one, it is a cancer, then cancer will be staged, and according to the stage and the histopathology, it will be treated surgically and followed by the chemotherapy and radiotherapy. So in summary, we can say that if the female having discharge, so first of all, female herself examine first of all both the breast, and if there is a pain or not, if there's swelling or not, and then see the discharge of the nipple, that what type of discharge it is. So as per my description, she can assess that what type of discharge it is, and get consulted with the concerned doctor or the breast surgeon and get treated. Thank you very much for watching my YouTube channel. Please do subscribe and share with your family and friends.